Medical leaders have warned that there is a real danger of the NHS being unable to cope in England if people don't stick to local lockdown measures.
The Academy of Medical Royal Colleges has said the health service could be back at square one without drastic action.
Right, let's get more on this now from the Academy's chair, Dr Helen Stokes-Lampard. Morning to you. Thank you so much for joining us. So, where are we right now with hospitals, with the amount of people being admitted, and how does that compare to, I don't know, the peak of the pandemic?
Well, it's really difficult to compare the peak of pandemic with respect to cases, but hospital admissions are very measurable and are very accurate with respect to coronavirus. And certainly the people who are in ITU are very comparable. So we do have good data. We'll be getting more data out later today, which will give us a clearer picture, but all the indications are not looking good. In the last month alone, we've gone from a few hundred people a day in hospital with coronavirus to thousands. So right now, I've got the figures here. We've got over 3,100 people in hospital with coronavirus around the UK. Actually, 500 of those are in ITU beds. That's really worrying. A month ago, we only had 60 people in the whole of the UK in ITU beds. So we are seeing a very worrying trend at the moment. Obviously, everyone has seen the massive spike in cases that's happening, but of course, that's more difficult to measure as a lot of people who have much milder symptoms are now being diagnosed, which we weren't back at the peak of things. So it's getting the perspective right. But as the cases go up, a few weeks later, hospital admissions do go up. A few weeks after that, unfortunately, intensive care goes up and deaths go up.
Right. Are there particular hotspots as well?
Yes, absolutely. We've all heard in the news about the challenges in the northeast and northwest of England, but there are other hotspots too. A lot of cities are now seeing serious problems. I'm based in the Midlands. We're seeing problems in Birmingham, but we're also seeing issues in Coventry and Nottingham, and it's working further south. We're also seeing some interesting patterns starting to happen in London again. So, yes, this is a problem actually affecting all four nations of the UK. We heard very serious restrictions and changes happening in Scotland yesterday. In Ireland and Northern Ireland, we're seeing challenges too. This virus doesn't know boundaries, and we need to learn its rules and work with it rather than trying to expect it to conform to the way we want to live.
I suppose the assessment I want from you is, how serious is it? Can the NHS cope?
Right now, the NHS can and is coping by and large. There are a few hospitals really struggling, but actually the NHS has learned a lot and is doing remarkably, at the same time as restoring services and trying to clear as much of the backlog as we can from all those hundreds of thousands, possibly millions of people waiting for treatment. But if we are having to dedicate a much greater proportion of our resource to COVID care, that means less resource available for all the other things we want to do. And of course, we'll always prioritise the really urgent and the desperately sick. And just while I'm here, can I just say, please, if you are sitting on worrying symptoms, a strange lump, strange bleeding, please come forward and get it checked out. We are open for business and always have been. And we know there are some people too frightened to come forward. And I don't want to add to that. And if people are there with serious mental health problems, please come forward. But as a society, as a population, we all have a responsibility to do our best to reduce the transmission, because if this gets out of control, as we fear it is, I mean, we are at that tipping point right now. This isn't a joke. This isn't scaremongering. I don't come from an organisation that does scaremongering. We care about people. We care about our patients, and we want to do the best for them and to keep doing the best for them through what was always going to be a difficult winter. Let's not make it a spectacularly difficult winter.
Let's talk about sort of local lockdowns, different restrictions. We know tighter restrictions coming in Scotland. What would you say about those? And there are, there's it depends on where you live, what rules you need to abide by, doesn't it? So what would you say about that?
I mean, I think the variation in rules, what lockdown means in one place to another, I think is really difficult. It's confusing, and I'm a great fan of complete clarity and consistency of messaging. And if we do get very simple messages, you're in category A, B and C, or red, amber and green, that will, I think, help, because I think consistency is so important. But the core messages haven't changed. Wash your hands, cover your face, keep the space, as backed up by an excellent test, track, trace and isolate plan. That is consistent. As far as local lockdowns, I think these are really difficult decisions for local politicians and national politicians to make. And I don't envy them that balancing act, because I recognise the huge benefits on people's emotional well-being and their mental health and well-being of some social contact. But we can do safe social contact, and that's what I'm desperately trying to encourage. Yes, contact and socialise at a safe distance If it's got to the point where local lockdowns are essential, please stick with them. I'm sorry, I don't like it more than anybody else, but this is for the good of us all. Please, let's protect our vulnerable this coming winter.
Helen Stokes-Lampard, Chair of the Academy of Medical Royal Colleges, thank you very much for your time here at Breakfast this morning. Thank you.